I'm Henry Samanya from ADRA Uganda, Response Coordinator for the current Ebola outbreak in Uganda. With the partnership with the Ministry of Health, they gave guidance that we need to come in on board as partners to ensure that we give support to respond to this Ebola outbreak. And today I want to say that we started with the Nebi district, and our work was to sensitize the district task force. This has been one and the first ever training of the district task force, so that they are equipped with the knowledge and the messages to take to the public. We are glad that the district task force was able to share with us the situation on ground and also the gaps that are found in the district. Being a neighboring district with the DRC Congo and speaking the same language with the same cultural things that they have in common, they have crisscrossing on the border. And at times they don't normally use the known border ways, they use porous borders. And in this case, it is hard to identify people who are coming from the DRC Congo. And so in this meeting, we had different resolutions, and we want to enforce and support the task force so that they are able to do their work to prevent the spread of Ebola. Why have we chosen Nebi? With guidance from Ministry of Health, ADRA was given 4 districts: Nebi, Arua, Zombo, and Pakwach. Those are the ones that were designated to ADRA to ensure that we respond to risk communication and community engagement. And so we have started with the Nebi so that we are able to enroll and educate and ensure that the masses and the community are aware of Ebola and to ensure that they have prevention measures. In this case, as ADRA, we are trying to make awareness and sensitization to the masses, and we can only achieve this with the local district task force. That's why we have started with it, with the training. And so from the district task force, they will be in position to train the VHT coordinators and the VHTs in these localities. And also we are able to ensure that we use different avenues to reach the public. We will ensure that we use the radio FMs, we have sport messages, the talk shows at the radio stations, so that we are able to reach as many masses as possible. As ADRA Uganda, we have started with the training, and when these districts are trained, now we will come in to ensure that we give them the necessary equipments like IPCs and also materials to use. Today, for the start, we were able to give out posters that communicate to the people about the prevention of Ebola. We were also able to give surveillance registers that are used in schools and referral forms, so that our children in school are able to be identified in case there is a case and they are referred to the health institutions. The work here at the district is enormous and is big, and one of the challenges they have identified on ground is that they need some facilitation in logistics. They need also to train their health personnel. They need also train their VHTs, and also they need engagements on borders. The challenge has been that when they don't meet the borders and they talk with leaders, it is hard to implement. But today, the district task force led by the resident district commissioner of Nebi, we have agreed that we do border engagements with the other side so that we sensitize them and they are able to understand. We have also carried with us standard operating procedures that work in public places, and we will ensure that these are done. And so in this week, we'll do the sensitization, and also the week to come, or at the end of this week, we will be in position to give them the materials like the hand wash stations that will be used to ensure that there is hygiene and sanitation. But we will also ensure that we give them the dustbins to health facilities so that they are able to keep their environment clean. We also ensure that these facilities are given the gloves and the medical masks so that they are able to do their work well in case of any unlikely event. And so we want to thank ADRA for the support that it has extended to these 4 districts, and we are sure that with this support, we will also add a brick to prevention of the Ebola outbreak. I thank you.